Well, for more, let's cross to London. Susan Michie is director of the University College London Centre for Behaviour Change. Many thanks for being with us here on France 24.
Hello, pleased to be here.
Your reaction, it really is the lifting of the last restrictions. It sounds like.
My reaction and the reaction of, I'd say, the huge majority of scientists and health professional leaders in this country is that now is certainly not the time to do this. We have currently tens of thousands of infections every day. We have 10,000 people in hospital, and we have 1,000 people a week with COVID on their death certificate. We are so far away from being in a safe state. And what removing these restrictions means is that there's going to be a very high level of transmission in our community. Our scientific advisory group in emergency suggests anything between 25 to 40% increase in transmission, which means that up to a quarter of the people of the population of Britain who are vulnerable because of their age or underlying conditions will not feel safe going out and about in everyday business. And we so easily could have continued until the spring, until the transmission rates are right down, with a cornerstone of pandemic control, which is test, trace and isolate, and then wearing face masks in indoor crowded places, which isn't a huge inconvenience for the sake of keeping people safe.
And so I guess it's a political decision. He has supporters who want their freedom back, quote unquote. What is it now a question of being civic minded or not, or can we be braced for? And this is where we get into behavioral issues. Can we be braced for testy moments when you walk into a room and half the people have their mask on, the other half don't?
When you have a situation where one person's behaviour profoundly affects another person's behaviour, as is the case with passive smoking or with traffic, then there's always legislation. We don't give individual freedom for people to decide what speed they want to drive their cars at or how much alcohol they have in their blood when they drive their cars. And we don't allow people to smoke indoors because that poisons the air with carcinogens, which will damage people's lungs and make them ill and even get cancer. Now, actually, having the levels of COVID in indoor shared public spaces is much more dangerous than passive smoking is. So what is extraordinary is that one's allowing one thing for most public health and safety areas, but another thing for COVID. And it sends out a message that actually things aren't as bad as we might think. And actually, it's not so important that you isolate when you're ill. You take away the legislation, you send out a message to people that this is less important.
So here in France, we've just reopened discotheques. We're just taking the masks off for kids in primary schools. Why is it going faster in Britain? What's the reason?
Well, because we haven't been shown any of the scientific evidence behind which the advice is being taken, people feel that this is not a public health strategy. It's a political strategy. Our Prime Minister is in a bit of political bother, and I think he needs to play to his supporters in a particular wing of his party. The scientific consensus is that now is not the time, and the gradual approach that you have in France and so many other countries is actually what's warranted to ensure that this doesn't get out of control and to ensure that we bring the level of transmission, the level of disease. And we must remember about long COVID. In the UK, depending on how you define it, it's anything between 1 and 3 million people have long COVID. This is a huge burden for the future for our health service. And we already have 6 million people on waiting lists for surgery and other treatments. This just doesn't make sense from a public health point of view.
Susan Michie, it's been 2 years since this coronavirus hit the planet. Do you feel as though people's attitudes will be different with or without legislation afterwards. I'll give you an example. Masks. I mean, I never wore a mask when I had a cold before. I'm thinking I might do it now. Do you think that that will change?
It's very interesting. It really depends on the leadership. In Japan and other countries in Southeast Asia, wearing face masks is just a basic measure of respect to people. Nobody would ever go out if they had so much as a sniffle or a tickle of a cough without a face mask on. And we could adopt that culture in other countries, but it does require leadership. It does require support. And what's been interesting in London, we've had chopping and changing of the legislation around face masks, with it being legislation being introduced, then removed, then introduced, and now removed again. And what we've seen is that actually the amount of face mask wearing goes up and down in accordance with legislation. Now, partly that is because most people want to obey the law, but partly people think if this is important enough that is underpinned by law, then this must be important enough to follow. And so I think it is really important that this kind of thing is signalled by legislation. And just saying it's up to individuals to do the sensible thing is really not going to do it for behaviours which are a bit inconvenient. For example, seatbelts on cars. There was huge resistance when that was first introduced. It was underpinned by very good public health messaging and legislation. Now it's just second nature. Pretty well everybody wears seatbelts. It's not seen as a problem. We could get to this for wearing face masks when transmission rates are high. But it requires a sort of multi-level strategy of legislation plus really good leadership plus very good messaging, just explaining that it's not just about protecting yourself, but it's about protecting other people. And as I said, up to a quarter of the population are vulnerable in one way or another, but you don't know who they are. Yes, people are elderly, you can tell that, but many people who have underlying conditions, one just doesn't know who they are. So it is a basic respect for people, but it requires a cultural shift, and that requires leadership.
And are you sensing that cultural shift to what we call here in France présentéisme, which is the opposite of absenteeism, which is you're sick, you might have the flu, but you want to soldier on and because you've got that big project to hand in and you got to get to the office?
Well, this is where we need leadership from employers, that employers and managers in their own organisations need to really be part of this whole strategy of encouraging people to stay at home if they think they might be infectious. But employers need support to do that. They need guidance. And this change today has not been planned with help for employers as to how to deal with this sort of situation. So again, yes, it's really important to have, build back better. Don't just go back to our old ways where we go in coughing and sneezing and spreading illnesses around, because now, yes, coughs and colds are really unpleasant and can lay some people very low. But COVID, as we know, for many people, it's mild, especially if you've been vaccinated. But it is a bit of a Russian roulette. For some people, sadly, it leads to long-term disability and even death.
Susan Michie, Director of the University College London Centre for Behavioural Change, thank you so much for speaking with us here on France 24.
My pleasure. Goodbye.